Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Tooth Talk, I have Dr. Fayaz Pasha. To give you a brief introduction about Dr. Fayaz, Dr. Fayaz Pasha completed his BDS in the year 2003. He was awarded the Best Outgoing Student of the Year. He has his master's in prosthodontics from the VS Dental College and Hospital, Rajiv Gandhi University, Bangalore. Dr. Fayaz is a diplomate of the ICOI and a member of the American Academy of Implant Dentistry. He has worked as an associate professor at the VS Dental College from the years 2006 to 2015. Dr. Fayaz has 2 dental treatment centers in Bangalore. He has given many lectures on implants and prosthodontics at various national and international conferences. He has conducted several workshops for the training of other dentists in the field of implants. He has published several articles and studies in various journals. Presently, he is working as a specialist prosthodontist and implantologist at the NMC Healthcare UAE. He specializes in doing Hollywood smile, keyhole implant surgeries, and full mouth rehabilitation cases. Dr. Fayaz, thank you so much for joining me in today's To Talk with Your Dentist conversation, and a warm welcome to you.
Thank you, Dr. Rekha. So good evening, everybody, and thank you, Rekha, for such a lovely introduction. And I hope in Bangalore everybody's doing well. I just traveled from Dubai to Bangalore just last week with a lot of travel restrictions now. Anyway, we'll come to today's topic. It's regarding the implants, the tooth loss and the implants.
Yes.
So first of all, a lot of patients come and ask us about, the replacement of the teeth. It may be a single tooth loss or multiple teeth.
Yes.
And as a prosthodontist, we do deal with the specialty where we replace the entire dentition and at the maximum. So what happens? First, we have to understand why there is a tooth loss. We know that as adults we have 32 permanent teeth. Where we have most of us have actively around 28 teeth which are functioning, 4 are wisdom teeth. Now, what happens in the process? We encounter a lot of dental problems which will lead to tooth loss.
Yes.
If I name few causes, like the simplest thing which comes to our mind is decaying. The tooth will get decayed, then it'll go into the root area, then there'll be infection, and finally your dentist will ask you to remove your tooth. So that's one of the common reasons. Then we have some other reasons, like there'll be some trauma, like accident you encounter, and you lose teeth. Sometimes the front teeth, most commonly we lose in accident. Then we have some other problems like gum problems. Yes. So if you have gum infection, which happens a little later at age, due to the poor oral hygiene and things like that, then people will lose teeth. Then there are some other problems like genetic problems, which are very rare, but they are there. And there will be some genital malformations, there may anodontia, or there will be some other conditions where people will lose teeth. Now, what are the consequences of this? What are the problems people will encounter? So there are 2 problems when you don't have teeth. If the front teeth are lost, you have cosmetic problem. You will not be very confident to face the society with missing teeth. And sometimes if you have missing lower teeth, or missing upper teeth, your speech also will become very, blunt. You can't pronounce some sharp, consonants like B, fish. If we ask you to do, it'll become, pronouncing S sound, it will become very blunt. So those are the, phonetic problems. And also you have cosmetic problems, like you don't look good, or when you start opening your mouth and talking, then people will start noticing you have missing teeth, which is not aesthetic. Then finally you have functional problems, like you want to enjoy food, you want to chew food, you want to have different type of hard food, but once you lose your teeth, you will not be able to do all this. So you will not be able to enjoy the food basically. So in life, if you don't enjoy the food, it's like a big depression for some people.
Yes,
They're not eating good food and they like it,
yes,
and other people are
yes,
eating in the family, and you're not
yes,
able to eat because you don't have
yes,
teeth. So these are the functional problems. So when you have, starting from one single missing tooth, if you have removed one tooth, for example, the first molar, if you have removed, what will happen over a period of time if you don't replace it? Other teeth will start moving because they have a space, and they start moving, and over a period of time, they'll be probably the upper tooth would have come down, or the lower back tooth would have come a little front, and they would have bent little, and all those problems, and this will lead to other problems like gum
yes,
problems and things like that. Why I'm telling all this is, replacing the tooth is very important. So whenever you
correct.
have a tooth loss, think of replacing what is missing in the human body, including your teeth. That is very, very important. So we have many options as a dentist, as a prosthodontist. uh, we give many options to the people or our patients who complain of missing teeth, starting from the single tooth, which is missing in the front or the back side. So we have traditional prostheses called removable prostheses, which we make and give,
Yes,
where patients can, put it and remove it. Like
good.
front teeth, if missing, you would have seen many flippers patients just you wear it and remove it. So the simple, very easy options of
Yes,
removable teeth. But removable teeth have their own disadvantages, because if you put it to the upper jaw, they cover with a plate, and you'll have talking problem, discomfort, and other things. And you have to maintain it, remove it every day, and put it. People opt for fixed teeth actually. Whenever there is a possibility of fixing the teeth, generally patients ask us to give the fixed solution, so which is called like permanent solution. So in such cases, we offer them two options. One is bridging the teeth, which is again a very traditional concept of fixing the teeth in the mouth. So where we take the support of the adjacent teeth. For example, if you don't have front tooth, we take the support of other two adjacent teeth, shape them, and put crowns on them, and attach one more tooth, and we bridge the teeth basically. So it's called a bridging the teeth. So that's a very traditional concept, and it really works also, and it's been working for a very, very long time. We have studies which are there like more than 80 to 100 years about dental bridging, which we know it. It's a very promising treatment option. But of late, from past 40-50 years, we have something called implanting the teeth. That's what the topic today we want to touch
touch
upon.
upon.
So implanting
Yes,
the teeth, basically, we are going to create a tooth kind of situation in the jaw. Like the tooth has a crown and the root, so we
yes.
want to create something like that by putting a titanium screw which acts like a root, and we are going to put a crown on your tooth. So this,
Almost trying to replicate.
exactly. So it's like the most closest way of how our teeth are. So we are trying to mimic the what God has given us and trying to recreate it. And titanium, the accidental discovery of osseointegration, where we found out that titanium can fuse with the bone very strongly, and it can anchor to the bone and serve as a root area to a crown. That gives us the whole treatment
Idea.
approach to this dental implant. So what we are going to do in this, we are going to put a titanium screw, and we can put a crown on missing tooth, so we don't touch the other teeth. This is the whole concept of implanting the tooth. So I said removable teeth, I said fixed teeth with bridging, I said fixed tooth with an implant if there is single missing tooth. And we can definitely do implants if multiple missing teeth are there. Now, this idea of implanting looks a little fascinating, because we are going to create like how it was earlier, your tooth.
Yes,
But there is a small surgery involved. That's the part patients are really a bit scared of.
instead of.
That there'll be a surgery again. They have to put the screw into the bone. They're going to drill the bone and all those things. But trust me, with a very good surgical techniques and the anesthetic systems we have today, it's absolutely
Painless.
painless or very, very minimal pain, and it can be managed very well. And now, who are these eligible patients who can get implants? This is the next
Yes,
question they ask us.
yes.
So if you ask me who are the patients, to tell you very simply, the patients who are eligible for dental extractions are eligible for dental implants also. It's as
Mm-hmm.
simple as that. So whenever we do the practice, if we have to do dental extractions, whatever precautions we take or whatever investigations we do, so same thing can apply for the dental implants. For simple dental implant cases. If you're doing extensive cases like full mouth, you're putting full art jaws, then again, you can get into the patient's medical history or the medical condition we need to see. And probably sometimes if the patients have multiple problems, more than one systemic problem, like they have diabetes, they have hypertension, they have other problems, then probably we have to get a physical a fitness certificate from
Mm.
a
Medical professional.
doctor, medical doctor they are getting treated, so that we get to know that they are fit for this dental treatment. So these are the about the patients who are uh, eligible for the dental implants. And some people ask me about the age. So
Yes.
we know that mostly in the old age only people will have missing teeth. Young people have very less missing teeth things kind of thing. So old age people, there is nothing like there is a age limit or something like that. We can do it as old as patient, unless they are very fit and to get it done. In my experience, I had placed implants for 85-year-old lady who survived 10 years till 95 years, and she really enjoyed the food. So there is no limit of age. Like if the patient is fit and they are they can take up the surgical treatment or a small surgical treatment. Definitely age is not a limit at all. And at a lower the scale, if you can see the young patients, there is always debatable, can we do it on
Definitely.
children. So generally we say that once the growth is complete, to be on safer side, once the growth is complete, like 16, 17 years, then I think we can take up for the young patients for dental implants. So these are the two age limits we can have. I said this is like the age uh, criteria we
Age
see for
range.
dental implants. Yeah. Then we come into the some finally like diagnostic. It's what we are
Diagnostic.
going to check
Yes.
when we want to place an implant.
Plant.
See what is very important if we are choosing the dental implant treatment is your bone. So
Yes.
bone, we call it as a gold standard for us for doing this treatment. If you have bone, there's absolutely no problem. What I mean to say is, we take radiograph. We check whether you have sufficient bone. Bone means what happens is after you remove the tooth, there will be some amount of shrinking of bone. The bone will
Got
shrink. The jaws will become a little smaller. So we don't want that to happen. We want more bone, so that we put a bigger screw and make it a very hard foundation so that we can put a nice tooth on it. So the bone we are going to see in your radiograph, a simple radiograph we take. And sometimes if we want to investigate more about your bone, how much you have bone, or you have bone loss or something, sometimes you have nerves coming in the way, sometimes you
it.
have sinus coming in the way in the upper jaw. So we need to see all those things. So in such cases, if we want to investigate more, we do one more scan. It's a CT scan, but we call it as cone beam CT scan. So basically Denta scan, we call it as different names. So it basically gives us only that area, the 3D picture it gives, or a lifelike hard tissue picture it gives, where we can see in all the angles how much of bone you have.
Yes.
So that will give us an exact picture or a clue or a whole option of choosing a right implant for your case and placing it over it. Now if I talk about technology we have today, so we have a cutting edge technology, we have nanotechnology, and in dentistry, all this technology is really helping us, and we understand the bone better than before. So we can do something called virtual surgeries also. So with the help of these scans, we can do virtually perform surgeries with the software on the system, and we can see the end result. And same thing we can discuss with you, and we can do it in reality.
In
So from
reality.
virtual to reality, it is possible, and that will give us the entire idea how the treatment is going to from the beginning to the end. So that's a great tool for us to do it. And other, like if you talk about some more advances, we have something called socket preservation today. The socket preservation is nothing but we remove the tooth and put as bone graft, and we preserve the bone. So earlier it was not there, but from past few years we do something called socket preservation, which really helps us a lot to maintain your architecture of the bone. Then We have something called partial extraction therapy, another advancement where we leave a small part of your tooth in the front and we remove the entire part of the tooth and we put an implant to get that nice profile or nice look of your front teeth, so that gum line will not go up.
Yes.
So we have that procedure, and one more procedure, like if we can do something called we can use surgery guides to do sometimes the flapless surgeries. Means we are not going to perform a real surgery like cutting using the BP blade, cutting and opening your gums and seeing the bone and putting. Everything will be done with a surgery guide which guides us exactly to go and put it and come out with a small keyhole. That's why we call it as keyhole surgeries. They are extremely very good, very fast, painless, bloodless. So
Yes.
these kind of surgeries are there today, which are very good for the patients. When we do such kind of surgeries for single teeth, patients are really happy. They really don't complain of pain. With a very, very minimal dose of medication, they are very, very fine. And these are all the things which are really there with us today. And definitely, we can help all our patients who are looking for replacing their missing teeth with dental implants. This is
Doc-
about it.
yeah.
Then over to you, Dr. Rekha.
Yeah, so Dr. Fayaz, that was, I think, very, very informative to our patients. I just hope, they'll be able to understand, who possibly is a good candidate for an implant. So, Dr. Fayaz, you did mention and say that you do what you call as total oral rehabilitation cases. So, which means multiple teeth are missing or probably all teeth are missing. So, in such cases, what is the maximum number of implants you can possibly place in a patient?
Yeah. If patient have completely missing teeth, we call them as edentulous cases. So generally, there are many concepts, but everything depends on the available bone. As I said, a bone is gold standard. I'm repeating this sentence because we want bone to place implants. So if you have good bone, then we can place as many like up to 6 or 8 implants sometimes, and we can give good teeth. So we have to remember one thing: more number of implants we place, our foundation is more stronger. So
Yes,
around 6 implants is like the worldwide they say are ideal for putting for the whole complete jaw, upper jaw, lower jaw, anything. But if there is a deficient bone, if there is no bone, especially in the back area, if there is no bone, there's a bone loss. Especially in the lower jaw, there will be a nerve which is coming up and opening with the mental foramen, and upper jaw we have sinus. So only in the front areas, if there is a bone, and back area there's no bone, then we can use something called all on four concept, which is very, very famous, tilted
yes,
implant concept, where we put long four implants and we try and accommodate. And still, if the bone is not there, still there are options of engaging the cheekbone, the zygomatic bone, and we can put implants, and still we can rehabilitate. Such difficult cases also can be managed
that,
with experienced clinicians.
yes,
So these are the different options. But what I suggest is, I see a lot of patients who are edentulous and wearing dentures. And what I suggest is, if a patient has loose dentures, at least go for 2 implants and fix the denture, so that denture will not move in the mouth, and they'll
no,
have quality of life. And also, because the dentures are not moving, they're stable, they can be able to eat, at least chew hard food, and have a good at least quality of life. With 2 implants also, we can fix your own dentures which are slightly mobile, or slowly, which are becoming mobile over a period of time. So now the standard of care in Western countries has become like at least minimum 2 implants for a denture.
denture,
So nobody's just doing only dentures.
dentures.
So that's how the
Yes.
standard of care has become. But starting from 2 implants for the answer, if the question you asked me, if I have to give you the answer, minimum 2 implants, maximum 6 to 8 implants per jaw we can do, and we can, yeah.
Manage. So Dr. Fayaz, I think one common doubts patients have is about the cost of these treatments. Generally, it is perceived that dental treatments are expensive. So implants definitely come on the higher side of the dental treatment spectrum. So,
Yes.
what would you say? I mean, if the patient has to weigh against the cost of the treatment and his health, what would you say about that?
Yeah, this is a very, very important thing. The question you're asking me about the cost of the treatment, and you already pointed out that it's a bit expensive side compared to a lot of other dental treatments. Yes, the product itself is expensive. So if you have to purchase a dental implant titanium screw, and the product is expensive, again it depends on the countries which are making. And again, there are some Far East countries which are making, like Korean countries, which are more economical than if you go into the European or US brands. They are a little more expensive, but depends on the individual practice and the experience of the doctor, the product they use, and again the material they use for the crown on it, PFM or zirconia, all that will involve, and the geographical area they are practicing, all those things. Personally, I practice in India and also in Dubai, so the cost varies a lot from here to there. So at
Yes.
least 4 to 5 times it increases. But generally, I think here in Bangalore, where we are practicing, the cost goes somewhere between 25-30,000 up to 50,000 rupees per implant and the crown, depending on the make and condition, and the one more very important thing, severity of the condition. If we have to use a bone graft for a case, then
Yes.
again added cost will be there. So a simple case definitely will cost somewhere between say 25 to 30, 40,000, depending on the doctor who wants to charge his patients. But again, added cost will be there always if the difficulty level increases. If you go for full mouth, again the cost goes significantly higher.
But any day, I think implants would be a better treatment option for possibly even a single missing teeth, or like you said, patients who have more number of missing teeth in their mouth, so that it provides a support.
Yes. See, if you talk about single missing tooth, we have two options to fixing it. One is the bridge, one is the implant. Now we take the longevity of survival, and there are many studies. Once important study, and in my experience also, which I've seen, like if you put a bridge 3 unit and put an implant, see the bridge after 10 years, if you have put like 100 bridges, around 60 to 80% of bridges will survive. Around 20 to 30% of bridges will fail because of dental caries or periodontal problem of the abutment teeth or the supporting teeth.
Supporting
But
tooth.
whereas implant has shown us the success rate of 95%. So more than 95% implants have shown us the success rate. So there is, for every 100 patient, there is a 20 to 30% more success with dental implants. So we patients should think themselves like what type of treatment modality they want. A treatment modality which is very highly successful up to 95%, or a treatment modality which is 6 to 80%. And let me tell you, these economical treatments are always quick, they are
Yes.
fast, it will be economical and easy to do comparatively. Anything we have to recreate naturally will take time, will have added a cost involved in it and patience, but the end result will be very good. And if you think of longevity and the investment, if you take both into consideration, definitely dental implants will always win over 3 unit bridge.
Yes, yes, yes. So, Dr. Fayez, that was really very informative, and I really hope all our patients who watch this talk will get at least a very basic, a fair idea about dental implants and who are the eligible candidates for a dental implant. And and I should thank you so much for joining me today in today's talk and sharing your experience and knowledge to our patients.
Thank you, Dr. Rekha. Thank you for inviting
Yeah.
me for your
Yeah.
small talk.
And I really hope, I mean, I think again, implants itself is such a vast subject. There is so much
Yes.
study going on, so much newer concepts that are coming up, and dentistry itself is such a broad subject again. So, and I really hope, I can get you back to do another talk with our patients and share your experiences with them, so that they learn and understand something more about their oral and dental health.
Definitely, Dr. Rekha, I would love to join you anytime.
Thank you. Thank you
Thank
so much.
you. Take
So, viewers, that was Dr. Fayaz, who did share with us his experiences and knowledge about missing teeth and their replacement options, especially with dental implants. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. So, if you want to get in touch with Dr. Fayaz, his contact details is given below in the description box. You can have a look at it. And until next time that I come back with another expert who will talk to you and share their knowledge and experiences about your oral and dental health, keep smiling, stay safe, and be happy. Thank you.